Here in the U.S., of course, cases are still climbing, and there is growing concern about an even bigger spike over the next several days, of course, because of the holidays. Joining us this afternoon to talk more about it is Dr. Henry Anyimadu, Infectious Disease Specialist at the Hospital of Central Connecticut. Doctor, thank you very much for joining us today.
Thank you for having me, Mark.
If people were at a Christmas party or maybe a gathering on New Year's Eve, would they be sick already? I mean, are you already seeing a surge?
So normally it takes about 5 days after exposure, averagely, to start seeing infections. So we'll be looking somewhere between seven to a week to 2 weeks. So that's when we'll begin to see increase in the cases from Christmas gatherings and from New Year gatherings as well.
I know that we're looking at some video right now, Doctor, of folks at the airport after the holiday, and they had reported that, the Sunday after Christmas or after New Year's was like the busiest in a very long time. I would imagine that's very concerning for you.
That is definitely concerning because, the concern about surge in cases is hospitalizations. And whenever there's a surge in cases, that means there's more hospitalizations. And whenever there's more hospitalizations, it means that there's more deaths. So it's very concerning with the holidays in succession, Christmas to New Year. We are very concerned about a possible surge.
What about this new variant? I understand it's already been detected nearby, over in New York, obviously a few other states. Is this concerning you?
That's right. So my guess is that the new variant is probably already circulating in Connecticut, especially if it's in New York already. There's nothing more that we can do but to continue wearing our mask and making sure that we are being vigilant and staying safe.
Aaron just mentioned a few moments ago about what they're doing in the UK right now, spreading out the time between that first and second dose of the vaccine to try and get more people partially protected. What are your thoughts on that idea?
It makes a lot of public health sense to delay so that everyone can get vaccinated. But we don't know for sure if it makes scientific sense because it's not tested, it's not proven. We don't know how long the immunity from the first dose will even last, right? So if you're going to prolong it and wait 12 weeks instead of the 3 weeks to give it, we don't know if people will still be protected at that time. And again, the other thing that we don't know is that if people are going to mount immunity to it with the first dose, is that immunity significant enough between the initial primer dose and the booster dose? So there's a lot of unknowns, and I know that it makes a lot of public health sense to get everyone at least one dose. But how long is it going to take us to do that? It will take a while. It's definitely not going to take 3 weeks or even 12 weeks to vaccinate everyone. So there's a lot more that we need to learn, and we need a lot more data to be able to say that we should do that in the U.S.
Well, in the meantime, like you said, Doctor, social distance and wear those masks, right?
That's right.
Thank you very much, Dr. Henry Anyimadu, Infectious Diseases Specialist at the Hospital of Central Connecticut. We appreciate the time this afternoon.
Thank you for having me.